Hi friends, welcome back to my channel. Today I am going to discuss various reference points of the Facebow. According to GPT-9, Facebow is defined as an instrument which is used to record spatial relationship of maxillary arch to some anatomy reference point or points and then transfer this relationship to an articulator. And it orients the dental cast in the same relationship to the opening axis of the articulator. And customarily, the anatomy references are mandibular transverse horizontal axis and one other selected anterior reference point. So, let's discuss about what are those reference points. Okay. There are two types of reference points. First one is the anterior reference points and second one is posterior reference points. What are those anterior reference points? In this picture, it shows various anterior reference points. Let's discuss them in detail. Okay. According to an article, Anterior Point of Reference, Current Knowledge and Perspectives in Prosthodontics by Kumar et al. The advantages of anterior reference points are it determines which plane in the head will become the plane of reference. That means which plane in the head that will become the plane of reference. And then determine the level at which the casts are mounted. Establish a baseline for comparative studies between the patient. It can visualize anterior teeth and occlusion in the articulator in the same frame of reference. So these are the various advantages of the anterior reference point. Coming to various anterior reference points. This picture clearly shows various anterior reference points. A, B, C, D. Okay. So what is this A? It is nasion. Nasion is one of the anterior reference points. Actually, nasion is used with quick mount Facebow or whip mix Facebow. So nasion is used with quick mount Facebow or whip mix Facebow. So one of the anterior reference point is nasion. Okay. So where it is used? It is used with quick mount Facebow or whip mix Facebow. Second one is the orbital. This one B, K. Actually, orbital is the anterior reference point which is located by canal Facebow with the help of an orbital point. It is also used for fascia type and earpiece type. Okay. Third anterior reference point is orbital minus 7 mm. This one is okay. And this plane represents the Frankfurt plane. Then fourth one is ala of nose. This plane represents the campus plane. Here it is the ala of nose. Ala of nose. This plane represents the campus plane. Then fifth point is 43 mm superior to the lower border of upper lip. Actually, it is located by Dinar reference plane locator. And here it uses in the Dinar or slidomatic Facebow uses this reference point. So which are those anterior reference points? Nasion, orbital, orbital minus 7 mm, ala of nose, 43 mm superior to the lower border of upper lip. Okay. What is an orbital? Orbital is the lowest point on the infraorbital rim, palpated through tissue and skin. Here it is the orbital. Okay. And here this one is the orbital. That is the lowest point on the infraorbital rim. It is palpated through the tissue and skin. What is axis orbital plane? Here one orbital and two posterior points determine the axis orbital plane. Okay. Here AO, that is the axis orbital plane. Second one is orbital minus 7 mm. Okay, this one is the orbital minus 7 mm. Okay, here is the point. FH plane passes through both orbital point and the porion. Okay, because porion is a fixed point on the skull, it is considered as a posterior landmark on the patient. So FH plane which passes through the porion and one orbital, because these points are bony landmarks. Seizure, he recommends using the midpoint of the external auditory meatus as posterior cranial landmark. And this landmark lies 7 mm superior to the axis and recommends the compensation by making anterior point of reference 7 mm below the orbital or positioning the orbital pointer 7 mm above in the articulator to the orbital indicator. Okay. So this is the FH plane. Here it is porion and here it is orbital. Okay. So this is the orbital minus 7 mm here. The next one is the nasion or nasion minus 23 mm. Here it is the nasion. Okay. According to Seizure, another skull landmark, nasion, which is located in the head as the deepest part of the midline depression. Okay, just below the level of eyebrow. And the nasion gate is designed to be used with Whip-mix articulator which fits in the depression. Here it is the Whip-mix articulator and here nasion gate is designed to be used with this type of articulator. Here it is nasion relator. Okay, nasion gate is there. Okay. So this one is the nasion gate and here it is the Facebow crossbar. This is 23 mm. Okay. So nasion minus 23 mm is the another reference point. Nasion and nasion minus 23 mm are both are the anterior reference points. Next one is the ala of nose. Tentative occlusal plane should be parallel to the horizontal plane. Okay, and this can be achieved in two ways. Line from the ala of nose to the center of auditory meatus. Here it is the campus plane or campus line. Okay. Point on right and left ala. Occlusal rim parallel to the campus line. Transfer with Facebow. This is the occlusal plane. Okay. Here it is parallel to the campus line. Next point is 43 mm superior to lower border of upper lip. Here, an anterior reference point is 43 mm superior to the lower border of upper lip. For dentulous patients, 43 mm superior to the incisal edge of upper central incisor for the dentulous patients. Okay, and in an edentulous patient, the anterior reference point is 43 mm superior to the lower border of upper lip in a relaxed state. So this anterior reference point is also used for Whip-mix articulators. Okay. This is the Dinar reference plane locator. And this plane locator is an instrument which resembles the Facebow. So this Dinar reference plane locator. Okay, this one is that. And Dinar or slidomatic Facebow which uses this reference point. Okay. That's all about anterior reference points. Now coming to the posterior reference points. Which are those posterior reference points and what are its role? Okay, what is that? Actually, the posterior reference points are very important in locating the hinge axis appropriately. Selection of 3 points in space which defines which plane will be termed the reference plane while fabricating a prosthesis. Okay, and many others come with various reference points, and the various reference points are Bergstrom point, Bayern Point, Geisy Point, Snow Point, Dinar Point, and also other points are also there. We'll discuss later. Okay. First one is the Bergstrom point. Which one is the Bergstrom point? This one is the Bergstrom point. Okay. What is its position? Actually, it is 10 mm anterior to the center of spherical insert for the external auditory meatus. This is the spherical insert for the external auditory meatus. And this is 7 mm below the FH plane. This is the FH plane. And this is 7 mm below the FH plane. So it is 10 mm anterior to the center of spherical insert for the external auditory meatus as well as 7 mm below the FH plane. And it is found to be most frequently closest to the hinge axis. So this is the Bergstrom point. Okay. Next one is the Bayern point. In this picture, it shows this one is the Bayern point. What is that? Actually, it is 13 mm anterior to the posterior margin of tragus of ear. This is the tragus of ear and it is 13 mm anterior to the posterior margin of tragus of ear on a line from the center of tragus extending to the corner of eye. Here it is the corner of eye. Okay. So, this is 13 mm anterior to the posterior margin of tragus of ear on a line from the center of tragus extending to the corner of eye. That is about the Bayern point. Next one is the Geisy point. This is 13 mm or 11 to 13 mm anterior to the most upper part of external auditory meatus on a line passing to the outer canthus of the eye. So this is 11 to 13 mm anterior to the upper third of the tragus of ear on a line extending from the upper margin of the external auditory meatus to the outer canthus of the eye. Here it is the outer canthus of eye. So this is 11 to 13 mm anterior to the tragus of ear or external auditory meatus. Okay. On a line passing to the outer canthus of eye. And this is the most common point used today. That is about the summary of posterior reference points. Here it is the tragus. Okay. Here it is the canthotragal line. And let's discuss the points in this figure. Okay. From this figure. Here, first one is that this is the 10 for memorizing these points. We have to find a easy way. Okay. So this is 10, this is 11, 12, 13. This is 5 mm, this is 7 mm. Okay. So what is Bayern point? This is the Bayern point. Actually, this Bayern point is in the canthotragal line itself. And this is 13 mm anterior to the posterior margin of tragus to the outer canthus of the eye. This is the canthotragal line. And this Bayern point is 13 mm anterior to the posterior margin of tragus to outer canthus of the eye. Okay, this is the Bayern point. The next one is the Geisy point. Geisy point is 13 mm anterior to the anterior margin of external auditory meatus. So, here it is the Geisy point. Then, this one is the Dinar point. Dinar's point is that 12 mm anterior to the posterior border of tragus. This is posterior border of tragus and this is 12 mm. And in here, the arrow mark shows 5 mm distance. It is 5 mm inferior to the line from external auditory meatus and outer canthus. Okay. So, what is this one? That is Dinar's point is 12 mm anterior to the posterior border of tragus, and it is 5 mm inferior to the line from external auditory meatus and outer canthus. That is about the Dinar's point. Next one is the Snow's point. Snow's point is that 11 to 13 mm anterior to the tragus. It is only 11 to 13 mm anterior to the tragus. That is Snow's point. Then Bergstrom point is that 10 mm anterior to the external auditory meatus and 7 mm below the FH plane. This is the 7 mm which is inferior to the FH plane. So that is all about the reference points seen in this diagram. Which are they? Bayern's point. Okay, here is the 13 mm anterior to posterior margin of tragus of outer canthus of eye. Bayern's point. Then Gacy's point, that is 13 mm anterior to the anterior margin of external auditory meatus. Then Snow's point, 11 to 13 mm anterior to the tragus. Then Dinar's point, 12 mm anterior to the posterior border of tragus and 5 mm inferior to the line from external auditory meatus and outer canthus. Then Bergstrom point, 10 mm anterior to the external auditory meatus and 7 mm below the FH plane. 7 mm below the FH plane. Okay. That is about the various posterior reference points in summarized version. Okay. Coming to an article by Shafullah et al. It is a simplified classification. It is a review article, okay, about the posterior reference points. According to this article, there are various other reference points also. Okay, this is Simpson's point. What is Simpson's point? It is 11 mm anterior to the superior border of tragus on the campus line. This is the campus line or the campus plane, and Simpson's point is that it is 11 mm anterior to the superior border of tragus. Okay. So what is the Bayern's point? Also already discussed. Then Weinberg's point. This is 11 to 13 mm range. It is anterior to the reference line drawn from middle and posterior border of the tragus. This one is the Weinberg's point. Then Brandup-Wangson's point. It is 12 mm anterior to the most prominent point of posterior border of tragus. And this is Whitmake's point. Then Shallon's point, it is 13 mm from the posterior margin of tragus to the canthus. Okay. Bergstrom already discussed. Dinar already discussed. Then Lauritsen's and Brodner's point. Here it is the here Lauritsen and Brodner identified a point 12 mm anterior to the middle of external auditory meatus and 2 mm inferior to the porion. Here it is the porion. So it is inferior to the porion 2 mm and 12 mm anterior to the middle of external auditory meatus. So based on anatomy of the tragus of ear is actually a commonly used anatomic reference. So these are the various reference points according to this article. Based on the accuracy of locating within 5 mm radius, table 3, this is the table 3, it summarizes the accuracy of locating the posterior reference points within 5 mm of true hinge axis position. So Shallon, Bayern, Walker, Palick, Nelson and White. So Shallon, 95% of axis points are located 13 mm anterior to the posterior margin of tragus on the canthor-tragal line. Okay. Bayern, approximately 87%. Lauritsen and Brodner, around 33%. Tetrek and Lundin found also similar results. Then also 33. Then Walker, it is 20. And Pallet Nelson and White, 50%. Okay. Then various reference points with reference to the tragus of ear. Tragal reference, superior border. These others are Winkler, Sensen, Simpson. These all are talk about the superior border of tragus. Okay. Then center of tragus by Bayron. Middle and posterior border by Weinberg. Posterior margin by Shalon and Beck, Brandrup, Wongson. Then posterior and superior border, Bergstrom and Dinar. Apex of tragus by McGregor. Base of tragus by Lundy. Okay. And with reference to the external acoustic meatus, position, if it's center, then the other is Lauritsen and Bonder. Then anterior wall, Whip mix, superior margin, Prothera, and anterior margin, Guess. That is about the various posterior reference points according to this article. Okay. So successful prosthetic rehabilitation, which involves complex modifications in the occlusion, has to be addressed by locating the hinge axis of the patient. And this should almost correspond to the opening axis of the articulator. Maxilla is oriented in space using 3 reference points, and thus it becomes essential for one to be aware of the relative significance of posterior reference points for any occlusal rehabilitation. So that is all about the various reference points, anterior and posterior reference points. That's all for today's lecture. Please do like, share and subscribe my channel for more videos. Thanks for watching. Stay home, stay safe.